Bangladesh is one of the most vulnerable countries as far as climate change is concerned. And one area that has not been explored much is how climate change is going to impact the health outcomes in Bangladesh. So the study was to better understand the linkages between climate change and health impacts. When we talk about climate change and health, it is not just health policy that will do the trick, but also we need to look at other policies as well. More in the broader realm of in terms of providing better access to water supply and sanitation, better prevention from natural disasters, better access to health facilities, better access to basic services like electricity and also the women's education and so on and so forth. So clearly what we found out was if we actually can take care of a lot of these confounding factors through development policy, I think that can significantly reduce the impact of climate change on health. When you're looking at from a policy perspective, one of the major findings of the study is that one has to mobilize resources, mobilize people. When you're trying to implement projects, one needs to be aware of what are the hotspots, where are the people living, and what part of the year are you thinking about in terms of implementing some of these programs and so on and so forth. I think that's really important. One of the major things that's happening in Bangladesh, of course, is there's been now a lot of migration within the country. People moving from coastal areas to inland, people moving from rural areas to urban areas, and that's resulting, for example, in a huge number of slums in cities, deplorable conditions, which actually creates a whole lot of new problems in terms of health. So clearly, I think it's very important to look also at the changing population dynamics within the country. Clearly, Bangladesh needs to have a climate change and health strategy. They have done one good thing in the sense that they have created now a climate change cell within the Ministry of Health to better understand these issues. That climate change cell needs to be strengthened so that it can actually act as a major resource in terms of bringing in the knowledge from the climate change side and also from the health side. Data is a big issue. So the climate change cell can actually play an important role in bringing the various data sets together so that we understand better the linkages and so on. Climate change and health impact, it's a big issue. We understand little about the direct or actual linkages. So this study is, we can say, is a small step in the direction, but we need to really do more such studies to understand better how to advise the policymakers in terms of directing their resources.